Hey everyone, this is Dr. Wolf in Austin, Texas. We're going to have a series of videos that review how to properly take care of your contact lenses, but as you can see, there's a lot that goes into contact lenses. What we're going to discuss today is going to be your contact lens solutions. Also, what is the difference between contact lens solution and saline, which is a common point of confusion or maybe misused terminology. We'll talk about even a little bit about eye drops and where those factor in with contact lens, not just contact lens wearers in general, but also during the application or removal process. Here at our practice in Austin Optometry Group, we do a lot of different types of contact lenses. We do your standard soft contact lenses that many people wear. We also do more specialized contact lenses, including rigid contact lenses, rigid gas permeable contact lenses. We do scleral contact lenses, hybrid contact lenses, and we also do orthokeratology. Each of the different contact lenses, they're basically treated slightly different as far as their care regimen, as far as even applying and removing the contact lenses. The products that you see on the table, these are the products that we most commonly recommend over here in my practice. These are not all of the products available as far as contact lens solutions, of course. There's much more in this. Even in the United States, there's much more. If you are a patient of our practice and you're watching this is likely what we're going to be discussing with you during your training and subsequent visits here in the office. If you're watching this online and you're not a patient of our practice, you are going to discuss this with your doctor because they may have a particular regimen they want you to follow. Starting over here to the side, these are going to be some soft contact lens solutions. Your multi-purpose soft contact lens solutions, including your hydrogen peroxide-based soft contact lens solutions. You're going to have some contact lens solutions that are going to be approved for various types of lenses, both rigid and soft lenses. And then you have some extra strength cleaners that may be only appropriate for certain types of lenses. In this particular situation, a rigid contact lens. You're going to have some lubricant supplemental solutions that are also only appropriate for certain types of lenses. And you're going to have some saline. Saline is, there's going to be quite a variety of different types of salines. So the first thing that we're going to do is essentially distinguish between saline and contact lens solution and what those terms mean. Saline is just salt water. It's not more than that, it's not less than that. You can get preserved saline from any grocery store or pharmacy. You can get non-preserved or sterile saline, not as easily from the grocery store or pharmacy, but you can get them through your doctor's office, very likely. You can get them from any number of online vendors, and then you might be able to get them from the pharmacy as well. But saline, again, it's just salt water, so there is no actual inherent disinfection properties with that. It's not just, it's not okay to just store your contact lenses in saline, and that's where the term contact lens solution is derived from. So all these products over here, these are contact lens solutions, and we reserve that term for disinfecting and cleaning systems. So many of these are saline based, meaning it's a liquid, it's a fluid that many of them are gentle and safe to put directly into the eye, but they also have properties to antimicrobial properties, bacteria, virus, fungus, spores, acanthamoeba. So they're intended to specifically disinfect and store your lenses overnight. You also have some products that are cleaning solutions that are hydrogen peroxide based, and these can be used with either soft or rigid contact lenses. Again, there is liquid in here, but it's hydrogen peroxide based. Now, it's different, slightly different than your regular hydrogen peroxide. It is 3% hydrogen peroxide, just like your store brand first aid kit hydrogen peroxide, but it does have some ingredients in it to include protein removers as well as some salt, so that when it neutralizes, and we can discuss that when we talk about this solution, when it neutralizes, it'll neutralize into saline, which again is salt water. So saline, when we talk about its use for the eyes, we use a very particular concentration. It's 0.9%. All of these salines that you see on the table are 0.9% sodium chloride solution, or 0.9% saline. The difference of the salines is essentially going to be if they are approved or not approved for use with the eyes, if they are balanced to match the pH of the eye or not, and then if they have any additives, not preservatives, but additives such as electrolytes. The first thing that we're going to talk about is saline, specifically just saline, different types of salines, when you would use each one, and which ones that we prefer and that we recommend. I don't have a sample of a preservative store-bought saline. Most any saline that you're going to find, if you go to the store and it just says the word saline on it, is not okay to put in your eyes, even though it may be in the eye care aisle. Maybe for just a real quick rinse or something, that might be a little bit different, but it's going to have preservatives, and some of these preservatives can be quite irritating to the surface of the eye, specifically the cornea. So we always recommend preservative-free sterile saline. These are all examples of preservative-free sterile saline. We're going to talk about each one. There may be one or two more available on the US market, but this is essentially pretty much everything that we use here in our office. Neutrophil is by far the best. Okay, neutrophil is going to be your sterile saline, but it's the only one that adds in electrolytes. Electrolytes being your calcium, magnesium, phosphate, potassium, along with the sodium chloride. That's true for all the others. The electrolytes are important because, just as you know about electrolytes from drinking, hydration fluids, these are basically salts that are within our body, and our body needs these things. Well, those salts are also in your tears. Your tears and the surface of your eye also needs electrolytes. You have those electrolytes in your tears every time you blink your eye, or they're washing over the surface of your eye. But certain contact lenses, specifically scleral lenses, are going to create a reservoir. And so whatever you put inside the contact lens and you place the contact lens against your eye, the contact lens, now that saline is in an enclosed system, and it's not going to exchange with the tears that wash over the contact lens. So every time you blink your eyes, you're going to wash new fresh tears over the surface of the contact lens, but not necessarily over the surface of the cornea, which will now be underneath that scleral lens. So whatever you fill the lens with when you place it against your eye, that's going to be in contact with the cornea, essentially all the way until you take the lens off. So the electrolytes in the neutrophil, they're very, very helpful. Most patients that wear scleral lenses that use the neutrophil, they do find it to be the most comfortable. It will cost a little bit more to do neutrophil, but in certain situations, we highly recommend it. Most notably are going to be your corneal opacity or corneal scar. Okay, I do think that it might have an advantage over regular saline in helping to reduce that scar opacity. There hasn't been any studies to date that show that, but anecdotally we found that to be true here in the office. Next is going to be Lacopure. Lacopure and neutrophil, they come in these individual vials. Okay. Whereas neutrophil comes in a slightly bigger individual vial with 10 milliliters. Lacopure is going to come in a 5 milliliter individual vial. You just twist off the top and break this apart and twist off the top, and you would use it accordingly. It comes in a box of about 90. I think it's actually 98 that come in a box. So this is going to be your sterile saline. Both of these are also pH balanced to match the pH of the eye. What is pH? pH is essentially just a measurement of acidity. So the eye is pretty much right in the middle between alkaline and acidic. But that's not necessarily true for all the products. Not all the products take that into account. So these are pH balanced, and therefore they can sometimes be referred to as balanced salt solution, or BSS. In some situations, they're one and the same. So Lacopure would be our second preferred choice if neutrophil wasn't an option for our patients that need sterile saline. Then you have Purulens. Purulens is the only one, at least the only one in the United States, that comes in a multi-use bottle. You can get them in smaller, 2-ounce bottles, okay? You can also get them in slightly bigger 4-ounce bottles. As far as the benefit of multi-use, well, that's personal preference, really. Some people prefer having a single-use saline, and then every day they just open it up and they have a fresh sterile ampule that they can use from. Other people prefer to use a bottle so that they can control, how much they use. Of note, once the bottle is opened, you have to throw it away after 14 days. Okay. So, but still, if you're using it appropriately, it should be about finished or finished within 14 days. But Purulens is also approved for use with the eyes. So Neutrophil, Lacopure, Purulens are all approved for use with eyes and with contact lenses. They are all on quote unquote on label, okay. But yes, it's going to somewhat depend on if you want a multi-use version like the Purulens Plus, or a single-use version like the Lacopure and the Neutrophil. And again, this would be in our order of preference or recommendation, particularly for our scleral lens wearers. And then you have Adipaks. Adipaks is a very common saline used with scleral lenses, and particularly, mostly because it's just cheap. You can get a box of this for about, I think, maybe about 100 of them, I believe, are in here. And it's about $20. The reason we do not recommend Adipaks is because although they are single-use 5 milliliter ampules, they are definitely not approved for use with the eyes. These are inhalation saline ampules. So this is for nebulizers, asthma treatments, COPD treatments. These are not for eye care. They're definitely off-label. The other reason we don't recommend it is that there has been some research to show that these do become acidic just a few minutes after opening. So once it is exposed to air, the pH in it starts to go down. But by going down, it actually means to become more acidic. So this can cause some irritation. It can cause a little bit more of tear film debris during scleral lens wear. So despite that it's attractive from a cost standpoint, it's not a good quality solution for the eyes. So now that we've discussed the difference in the different types of salines, we want to discuss when you would use saline and when you would use something like a contact lens solution. Saline is most notably used with scleral lens wear, which is a particular type of contact lens. It's a rigid contact lens that's a little bit bigger than the cornea, and the white part of your eye is called the sclera. So a scleral lens lands on the white part of your eye, and then it vaults up and over the cornea, leaving a space between the cornea and the contact lens that we call a fluid reservoir. So you do need to fill that fluid reservoir up with fluid, but it's not safe to use just water. So you want to use saline. And if you're going to use saline and it is an enclosed system, you want to use sterile saline, preservative-free saline, so that the cornea doesn't become irritated over time. So most notably, or most commonly, this is going to be used with scleral lenses, but it may be used with other types of contact lenses. Essentially, anytime that you want to rinse your contact lenses, you could use a saline. Another common use is going to be with orthokeratology. Orthokeratology is a contact lens that reshapes the top layer of the cornea overnight while you sleep. So we refer to them as retainers because it basically, you wear it like you would like a dental retainer, but you wear it for the eyes. And then when you wake up, you don't require any glasses or contact lenses anymore as long as you wear the retainer contact lens at night while you sleep. But it's actually very similar to a scleral lens in a particular portion of the cornea. So where the contact lens is aligning to the eye, it will then have these very subtle fluid reservoirs, which is how we control the reshaping of that superficial layer of cells on the cornea. But that reservoir is also an enclosed system. So that's why we want to use a sterile preservative-free saline. Now, because in orthokeratology, it's a very small reservoir compared to a scleral lens, which is a significantly larger reservoir, you'll use more saline with a scleral lens, a bigger size rigid contact lens, you're going to use very little saline with a smaller orthokeratology lens, despite the fact that we do want to use sterile preservative-free saline. So that's where most commonly we'll recommend the pure lens, because it does come in a multi-use bottle and we can use it day in and day out for the course of 14 days, but it also comes in a small bottle, a 2-ounce bottle, just like that. Now, some of our patients do prefer still the 4-ounce bottle, okay, which is perfectly fine. But again, it's personal preference as to how much saline that you like to use. You'll be using some to rinse both front and back surface of the lens before applying it to the eye, as well as filling up the inside of the contact lens prior to placing it on the eye. So again, most of these salines will be utilized with scleral lenses. They may also be utilized with orthokeratology lenses. They could be used with corneal gas permeable lenses, or sometimes referred to just as RGP, or rigid gas permeable contact lenses. But you could also use a preservative-free eye drop for those, whereas we wouldn't necessarily recommend doing that for scleral lenses and orthokeratology. You would never use Addipacks. As common as these are, you just would never use that for ortho-K or scleral lenses. It's not approved, it's not healthy for the cornea. In our practice, we recommend neutrophil first and foremost, with no exceptions regarding scleral lenses. This is going to be our best possible solution. Lacopure next to that, pure lens next to that. And then, not discussed today, there is scleral fill from Bausch & Lomb, which I don't have available on the table. There is also Vibrant View, and then there could be more to come. For orthokeratology, we recommend the pure lens. We recommend pure lens plus sterile saline for orthokeratology. For our corneal rigid gas permeable lenses, I think Pure Lens Plus is also a very nice saline just to rinse in the front and back of the lens. And because that doesn't have a enclosed reservoir per se, it won't matter as much as far as the type of saline, or versus doing something like a lubricant eye drop. For soft contact lenses, well, you can certainly use a sterile preservative-free saline to rinse your soft contact lenses as well. You just wouldn't be able to use a sterile preservative-free saline to store or disinfect or clean your soft contact lenses. Again, these do not have disinfecting properties like a multi-purpose or a specific cleaner or protein remover for contact lenses. That's not the purpose of saline. The purpose of saline is to rinse them, and then again, for certain lenses, to provide a fluid reservoir by design for the physiological fit of the contact lens. So these are your contact lens solutions. Contact lens solutions, again, that means basically a disinfecting system, cleaning system, most typically an overnight cleaning and storage system, with the exception of orthokeratology, which is again an overnight wearing contact lens, so then it would be a daytime cleaning and storing disinfecting system. For soft contact lenses, you have multi-purpose soft contact lens solutions. Multi-purpose means cleans, disinfects, rinses. It's a one-stop shop for everything that you need with your contact lens solution. Again, this is not the same as saline. Saline is just salt water, so contact lens solution will be different, and that is approved for cleaning and very important to avoid contamination of your lenses or potential risk of eye infection. You also, with soft contact lenses, do have hydrogen peroxide-based systems. So with hydrogen peroxide-based systems, these are good for cleaning and disinfection, but they're not okay for rinsing or for insertion. So you will want to be very careful about that. Hydrogen peroxide in the eye burns quite badly. And then you have multi-purpose solutions for rigid contact lenses. And this is, again, storage, disinfection, cleaning, rinsing the lens, application of the lens against the surface of the eye. But some of them are only approved for use with rigid contact lenses and not with soft contact lenses. And then you also have some that are approved for everything for soft and rigid and hybrid both in a multi-purpose. So quite a lot to digest there. We're going to begin with just a typical multi-purpose soft contact lens solution. There's a variety of these on the market. Revitolens is what's on the table here. BioTrue is another very common one that you may be familiar with. There is also OptiFree, and there's of course store brand generic versions of many of these. Again, that's okay to use for soft lenses. It's not approved for use with rigid lenses. Now, having said that, it would be off-label to use it with a rigid lens, but for some of our rigid lens patients, if they cannot find anything, let's say that they're traveling and they cannot find rigid contact lens disinfecting and storage systems, well, if that's the absolute only thing that they can find, acknowledging that it is off-label for rigid contact lenses, at least it would have some disinfection, and it does have agents in it to prevent, to essentially kill bacteria, virus, fungus, and so on. So certainly better than nothing, and better than just regular saline. Tangible Clean is a multi-purpose contact lens solution that's approved for use with rigid, hybrid lenses or soft lenses. Basically, you use this with any type of contact lens, including orthokeratology as well. This is the one that we basically use in the office for anything inside of our exam rooms. When we're training patients on contact lenses, we just recommend the Tangible Clean, partly because it is approved for use with everything, but also because it does it is compatible with certain coatings and applications on some of our contact lenses. Many of these bottles, you'll notice, can come in multiple sizes. You can typically get larger size bottles that might be a little more cost effective. And then you can also find smaller travel size bottles. And that's true for Tangible Clean as well as the soft multi-purpose solutions. Then we have Unique pH. Unique pH is also a very good multi-purpose contact lens cleaning system, but is only approved for rigid contact lenses. It's not approved for soft lenses. It's very thick, it's more viscous than the others. So if you were to put this on your soft contact lens, it would be very gummy, very slimy. So it's just not designed for that, only for rigid contact lenses, but it is an excellent solution. It also, I believe, comes in a couple different bottle sizes, but the largest, I think, is something like 4.5 ounces. It's not particularly large compared to some of these. The larger sizes, maybe about 12 ounces. Okay, that is our multi-purpose cleaning systems. Not mentioned are Boston. Boston is another company that makes rigid contact lens specific cleaners. And they do make a multi-purpose cleaner as well. That is an option that may be easier to find at the grocery store because Boston is owned by a much larger company, and it has been around for quite a while. Depending on the type of lens that you're using, though, it may or may not be ideal just because of the more aggressive cleaner, the more aggressive alcohol-based cleaner that comes with some of the Boston products. And then some of your contact lenses may have a special coating in which that cleaner may destroy the coating. The multi-purpose version is called Boston Simplus, and that is approved for use with tangible hydropeg or polyethylene glycol coating. And it's fine. Out of just personal preference, I tend to prefer the Tangible Clean and the Unique pH, but a lot of people do really enjoy the Boston Simplus as well. Now, for hydrogen peroxide-based cleaners, Clear Care is the one that's most common in the United States. There are going to be some generic alternatives. There have been some other companies that have had branded hydrogen peroxide-based systems as well. And then, outside the United States, I really just am not familiar with the options there. Clear Care does have two versions. Okay, this is very important to note. They have a Clear Care triple action that can be thought of as the original formula. And they also have a Clear Care Plus with Hydroglide. Regardless of if it's a soft contact lens, a rigid contact lens, we don't recommend the Clear Care Plus with Hydroglide. We only recommend the Clear Care Triple Action, or again, you can think of as the original formula. From our experience and the experience of others, the Clear Care Plus with Hydroglide doesn't clean quite as well, and it can leave a little bit of a film on some contact lenses. So we don't recommend that. Now, if that's all that you can find, well, certainly is better than nothing. And then if you, myself or your doctor, if you're not a patient of our practice, if your doctor has really recommended a hydrogen peroxide system, and again, you can't find the original version, again, it's better than nothing, but at your next opportunity to buy the triple action version, we recommend doing that. Now, this is 3% hydrogen peroxide. Now, 3% hydrogen peroxide might sound familiar to you because that's also the brown bottle hydrogen peroxide that you know from the first aid section. What's the difference? Well, the difference is with Clear Care, or again, eye care specific hydrogen peroxide systems, one, they're formulated specifically for the eye, okay, versus your 3% first aid kit peroxide would be considered off-label as far as the sterilization and the techniques that go into manufacturing and bottling. It's less controlled versus things that are made in eye care specific facilities. It's a little bit more oversight in that regard. If you're talking about just the chemical agent of the peroxide, there's some subtle differences there. So peroxide chemically is H2O2, and you may be familiar with H2O. H2O would be water, right? It's the basis of life. But peroxide, for having only one extra oxygen molecule, would be toxic. So if you were to drink peroxide, you'd get quite sick, of course, and the only difference is that one small molecule change. Well, with a particular contact lens solution, you do have a carbon disc at the bottom that creates a chemical reaction. That chemical reaction will convert the peroxide into either water or saline. So if you were to pour peroxide into this bottle here, or this container with the catalyst down at the bottom, it's going to create a bubbling and fizzling effect, and then after a few hours, that's going to neutralize completely into water. If you use it with Clear Care, okay, and this is the case that comes with Clear Care. With Clear Care, they've added some salts to make this turn into saline, and then there also are some protein removers, some protein enzyme cleaning additives in here as well to clean your contact lenses better than what you can do with just regular peroxide. So when you pour the Clear Care into the container, after a few hours, it again will neutralize into saline. All of your contact lens solutions, you do still need to manually rub, manually clean. So multi-purpose solutions, once upon a time, they were marketed more as a no-rub solution. Well, that was good from a marketing standpoint, but it wasn't very effective from a contact lens cleaning standpoint. So we do still recommend that even with a multi-purpose solution, you do manually clean the contact lenses after removing the contact lens from the eye prior to storing it overnight. Or again, if it's orthokeratology, you would remove the contact lens, clean it prior to storing it during the daytime. As far as the cases, well, multi-purpose solutions will have their own individual cases that look like a more traditional contact lens case. You do need to let those air dry. So after you're done storing disinfecting the lens overnight, you're going to apply the contact lens to the eye. You would dump the solution down the drain and let it air dry in a safe environment, free of bacteria and as free of airborne pathogens as possible. If you use something like Clear Care, we've already discussed, it has a different type of case. This type of case does not sit vertically, does not sit horizontally like your traditional soft contact lens cases. It's going to sit upright. And then when you unscrew it, you're going to have two little doors that flip down on the side, and they will be marked right and left. How we recommend doing it here in our office is to flip it like this so that you can put the contact lens into the basket, holding the basket, flip the contraption down around it. Alternatively, some people will put the contact lens on this little bump right here and then flip the basket around that. I don't recommend that because it can be easier to tear or chip the edge of your contact lens by doing it that way. Instead, prefer to hold the basket, put the contact lens inside the basket, making sure that the edges are safe and free of interaction with the case, and then flip the case down around that basket. With this, you're going to fill it up to the line. There's a line marking on the case there, and again, it'll fizz and bubble. To discuss the length of time, well, first and foremost, you just basically want to read the directions and follow the manufacturer's instructions. With soft contact lenses, you're going to want a few hours, typically at least 4 to 6 hours to fully neutralize or to fully disinfect. But an overnight is generally plenty. But usually it's going to be about 4, 5, 6 hours, depending on different contact lens products. And that's pretty much true for all the multi-purpose solutions. Clear care is going to be a little bit different depending on if it's a soft lens or a rigid contact lens. Okay, there's some common misconceptions about clear care. Clear care is going to, on the instructions, say that it needs to sit in there, I believe, for about 6 hours. Well, it certainly needs to be in there for 6 hours if you're using a soft contact lens, because that's about how long it takes for it to fully neutralize inside the case. This is an important thing to know about contact lenses. Soft contact lenses are absorbent. Rigid contact lenses are not absorbent. That's really important to know. If soft contact lenses are absorbent, then they can absorb any type of fluid. They'll absorb your tears, they'll absorb the saline, they'll absorb the contact lens solution that it's soaking in. If it's sitting in peroxide, it'll absorb the peroxide. And if it absorbs the peroxide, it means it's embedding itself into the material of the contact lens. You can think of the contact lens as having essentially like pores. And so that chemical is going to get inside those pores. Well, if you don't let it soak for the desired amount of time or the recommended amount of time, and you reinsert that contact lens against your eye, it's still going to have some of that peroxide. And again, peroxide on the eye, it's going to burn quite badly. So it really needs, for a soft contact lens or a hybrid contact lens, which is a soft and rigid combined, but anything that has a soft contact lens component is going to need to sit in there for typically the full 6 hours. This is not true for a rigid contact lens. Okay, with a rigid contact lens, meaning an orthokeratology contact lens, a corneal gas permeable or rigid gas permeable contact lens, or a scleral contact lens, these are not absorbent materials, meaning if you put the peroxide on the lens and then you realize, oh, I didn't want to do that, I need to put my contacts back in my eye. With a rigid contact lens, you can rinse it off. You can just rinse it off with saline, rinse it thoroughly front and back of the lens, rinse any peroxide off your hand if you're holding the contact lens in your hand, and then you can apply the lens with no problems. Now, for full disinfection with a rigid contact lens, it's about 3 hours. Okay. Now, you'll just basically soak it in there overnight anyways, so it doesn't really matter, but it takes a little bit less time for a rigid contact lens to fully disinfect than it does a soft contact lens to typically fully disinfect as far as pathogen disinfection. Okay, and that would be true with any kind of peroxide-based system. This is on the table again just to show that, in a pinch, if you had nothing else and you accepted the risk, you personally accepted the risk that you're using a product off-label, and you have thus been informed that it's off-label and has not been manufacturer approved for use with the eye, well, then it would still give you quite good disinfection, because peroxide in the world of contact lenses ultimately is kind of our standard. Okay, that's why we recommend clear care for all of our contact lens wearers. So in short, what do we recommend here at Austin Optometry Group for our contact lens wearers? If it is a single-use daily disposable soft contact lens, you're probably not going to need any contact lens solutions of any sort. If you do, a multi-purpose soft contact lens solution is great if you're just going to take your daily disposable, daily replacement soft contact lens out for, a nap or to take a shower or something like that. But we don't recommend reusing your daily disposable soft contact lenses. They're approved and designed to be worn that one day, and then you would get a fresh one the next time. If it's a 2-week or 1 month or quarterly replacement soft contact lens, we don't generally recommend your multi-purpose solutions as much as we recommend your Clear Care. Clear Care is just, again, it's kind of that gold standard cleaning, disinfecting system for multi-use contact lenses. So that takes care of our soft contact lens discussion. If it is a hybrid contact lens, which again is a soft lens and rigid lens both, then we recommend Tangible Clean. Tangible Clean, again, is approved for all types of contact lenses, soft and rigid. It's also approved with HydroPeg, and we can discuss HydroPeg in a moment, but it's a particular coating that comes on some of our contact lenses to increase lubrication and prevent deposits. So we recommend Tangible Clean for that. This is also great for just regular soft contact lens wearers for the same reasons I just mentioned, but again, for our soft contact lens or hybrid lens wearers that are using lenses several times, Tangible Clean, and then again, your Clear Care. Clear Care, again, just being kind of, I guess, your standard as far as thorough disinfection there. Okay. Unique pH, this is one that's used again for your corneal or scleral rigid contact lenses, although we don't use it as much in our practice, mostly because we like to rinse the lens off with saline before applying it on the eye, and some of these are a little bit thicker, a little more viscous. So again, if you like the comfort of a thicker, more viscous solution, then Unique pH is a great option for you. We instead typically still gravitate towards the Tangible Clean. So for our corneal gas permeable patients, our scleral lens patients, orthokeratology, soft lenses, hybrid lenses, Tangible Clean works with everything, so it's kind of a nice thing for that. Again, scleral lenses, orthokeratology, hybrid, soft lenses, Clear Care works on everything. So that's what's going to be kind of unique about this, is that these two you can use for any type of contact lens. Now, if you're doing orthokeratology, we really just recommend the Clear Care. The reason for that is because you're wearing the lens overnight, and if you were to have some kind of irritation, some issue, maybe the beginnings of an eye infection, well, with daytime contact lenses, you might have some awareness and you might notice that something's going on. You take your lens out before it becomes a bigger problem. But if you're wearing it as an overnight option, then you're sound asleep. You may not notice that there's an issue until you wake up, and at that point, it may be a larger issue. So that's why we really recommend with any kind of overnight wear contact lenses, specifically orthokeratology, also known as Ortho-K, that you use just the triple action Clear Care. Okay. Again, your regular store-bought peroxide is off-label and not recommended unless you have absolutely no other option. So now we're going to talk about going back to the Tangible product line. So Tangible Science, they actually make 3 different products currently. They make a multi-purpose cleaning and disinfecting solution for all types of contact lenses, which has been discussed. That's the Tangible Clean. They also make a product that's not on the table here. This is something that's done through the manufacturer, and it's called Tangible HydroPeg. HydroPeg is a coating, and it's a coating that can be applied to either soft lenses or rigid lenses, but it's just more commonly used in the rigid contact lens world. We see it mostly with scleral lenses. You may see it with hybrid lenses or even corneal gas permeable lenses, but scleral lenses is very, very, very popular. HydroPeg, PEG, stands for polyethylene glycol. Polyethylene glycol is essentially a liquid polymer that just makes it slick and slippery. And then the lens is essentially dipped in this polyethylene glycol during manufacturing, which gives it, again, a very slick feel to it. Well, the benefit of that is when you're wearing the lens, your tears will wash over that slick polyethylene glycol coating, and that makes it more comfortable, particularly for dry eye patients. It also avoids deposits. Deposits are basically anything inside your tear film that could stick to the plastic of the lens, whether soft lenses or rigid lenses. So commonly that's going to be proteins, it can be oils that are floating around inside the eye, but if there's a dry spot on the surface of the contact lens, that is where the deposit wants to adhere to the contact lens. And so when you use something like polyethylene glycol, it can't stick to the plastic of the lens. So we use it commonly. Now, polyethylene glycol, it wears down over time. You can think of it kind of like motor oil. You put motor oil inside your vehicle and it creates a lubrication basically for the internal components of that vehicle. The longer that you go though, it just naturally wears down. Eventually you would have to add more oil, and this is true for any, I guess, most any mechanics. So that's where the tangible boost comes in. If you don't want to have your lens recoated, and in many cases you can't have the lens recoated, there's very few options in the market for manufacturers that are willing to do that. But if you don't want to have your lens recoated or to have a new lens manufactured for you, then they do create the tangible boost product. Boost, what it sounds like, is basically more polyethylene glycol is inside of here, and it comes with a little case. You're going to soak it for 30 minutes, typically about once a month. Okay, you could do it more, but once a month is standard. When you soak it in here, the polyethylene glycol, it's a lighter version than what's initially first put on the lens. It will bind to existing polyethylene glycol. So if your lens is relatively new and it has some polyethylene glycol, it still feels kind of slick or slippery, you don't notice any deposits when you look at the lens, or your doctor hasn't mentioned anything, then that's a great time to use the Boost product to essentially supplement that coating. If the lens is old, the polyethylene glycol has worn off, maybe it was manufactured and never had that on there in the first place, or if you've used an agent to clean your lens that wasn't approved for use with the tangible hydropeg, and that's going to commonly be like tap water, alcohol-based cleaners, a lot of extra strength cleaners out there, they're going to strip that coating. At that point, when you put the Boost on there, it doesn't really bind to the plastic of the lens. You essentially need that base layer of tangible hydropeg for the tangible Boost to adhere to. If you don't have that, it doesn't work as well. If you are using a rigid gas permeable contact lens and you're going to need a extra strength cleaner, then we recommend Progent. Progent is basically a bleach-based cleaner. So it's approved for use with rigid lenses. It's not approved for use with soft lenses. As I may have mentioned before, soft lenses are absorbent. So if you were to put something like this on a soft contact lens, you essentially ruined the soft contact lens. And if you apply that soft contact lens to the eye, you would have a pretty bad chemical burn. So you cannot use Progent on soft contact lenses, only for rigid contact lenses. And this includes scleral lenses, orthokeratology, or corneal gas permeable lenses only. You can't use this with hybrid lenses, even though there is a rigid contact lens within a hybrid lens. There's also a soft contact lens component to a hybrid lens. So again, it would be absorbent. You just cannot do that. Now, if you know that your contact lens, your rigid contact lens, has tangible hydropeg on it, you wouldn't necessarily want to use the Progent unless you intentionally were trying to strip off the coating, or you just accepted the fact that by using Progent, you would strip off the coating. The Progent is very, very strong, and so it will essentially create a factory reset. It's going to make the lens as clean as possible, and I usually describe it as like you're getting a fresh lens, if it's used properly, if it's used as directed. It's directed to be used every 2 weeks. If you're doing other cleaning methods and you're very diligent, maybe you don't get a lot of deposits, and once a month is probably fine. But if you're going to strictly follow the directions from the manufacturer, it'll be used every 2 weeks. Similar to previously mentioned Tangible Boost, which is a 30-minute soak. That's the same for the Progen. It's just a 30-minute soak. It's going to have its own case in here. It's going to have its own solution here to follow the directions, and we can review the use of these products further another time. But this is going to be, again, your extra strength cleaner for any kind of rigid contact lens. So we've discussed saline, we've discussed contact lens cleaning disinfecting systems. I'd like to briefly discuss eye drops. We're not going to go too much in depth about the eye drops, but I just want to discuss it because sometimes eye drops are used during the application or removal process of contact lenses. There are a number of contact lens approved lubricant eye drops on the market. We are big fans of Optase over here at our practice. So specifically, their eye drops are going to be Optase Intense Dry Eye, Optase MGD Advanced, and then Optase Hyalo Relief. We'll go through the differences in all these products maybe in another video, but these are all preservative-free. They are all multi-use bottles, despite being preservative-free and sterile. They all have 300 eye drops per bottle. They're all approved for use with contact lenses, including both soft and rigid lenses. The difference is going to be basically viscosity, certain ingredients like maybe an oily layer, maybe a difference in the bottle design as far as operation of the bottle. Where you would use it, well, some people like to use it before putting in their contact lenses to add a moisture layer to their eyes. Some people like to put it in directly after they put their contact lenses in. And then some people like to put a drop inside the contact lens when placing it on the eye, just for a soft kind of lubricant-based cushion on the eye. Depending on the type of contact lens that you're doing will somewhat depend on which product that you use. We don't generally recommend it as a course for everybody. It's more personal preference. If you're using a rigid contact lens, like a corneal rigid gas permeable lens, it's very common to use some kind of lubricant drop inside the lens. It's a little bit more comfortable than just putting the lens on dry, essentially. Any of them are fine for that. If you're going to use orthokeratology, it's also very common that people use preservative-free lubricant eye drops inside the, we call it the bowl, basically the concave side, the curved side of the contact lens. So a lot of people put a preservative-free lubricant drop inside the contact lens when they apply an orthokeratology lens to the eye. I don't recommend that just because studies have shown that the lower the viscosity of that fluid layer between the lens and the eye, the greater the hydraulic forces. The higher the viscosity, the lower the hydraulic forces. And it is the hydraulic forces that's reshaping the corneal tissue during orthokeratology. Now, when you use something like a lubricant drop inside the contact lens, it may be more comfortable initially because, again, it's a more viscous, thicker cushion underneath the surface of the eye. And if it's a child who's using orthokeratology, which, globally, most of the time is children and adolescents that are doing orthokeratology more than adults, again, worldwide, due to the myopic epidemic, then perhaps a lubricant drop might have some advantages from a comfort or compliance standpoint. So you have to kind of take it case by case. If we're talking strictly from a therapeutic point of view and which one's going to give us the best results and the best reshaping effect, I don't recommend lubricant eye drops. Instead, I just recommend a sterile preservative-free saline. Now, if that prevents, good compliance, and of course using a lubricant drop, a sterile preservative-free lubricant drop would be the next best alternative. Now, when it comes to removing the contact lens, it's a similar discussion. Sometimes contact lenses, they can get a little bit dry with wear, whether it's a soft lens, a rigid lens, whatever, orthokeratology. So there are people who prefer to put a lubricant drop in their eye prior to removing the lens. If you're going to do that, then preservative-free sterile lubricant drops are excellent for that. And I'd probably wait maybe about put in the drop and wait about 5 minutes if possible before removing the contact lens. If you're doing something like a contact lens that requires what's commonly referred to as a plunger or a suction removal device, then also putting a lubricant drop on your eye a few minutes prior to doing that, it may allow that suction device to adhere to the contact lens a little bit better as well. So there's a lot of advantages to putting a sterile, preservative-free eye drop inside the eye prior to contact lens removal. The last product I want to mention is a hypochlorous acid spray. This is also from the company Optase. There are other companies that make these types of products as well. Okay, it's going to look like a bottle of spray, and it's just a gentle disinfecting spray. You can use it on your hands. You can use it on the surface of the table that you're working with your contact lenses, and you can spray directly on the lids or actually even directly onto the eyes. Very gentle, it feels like water. Hypochlorous acid, HOCl, as far as a chemical compound. Hypochlorous acid has been around for a long time, but it became particularly popular a few years ago during the COVID pandemic because it was effective against a number of different pathogens, including virus and including the COVID, the coronavirus, essentially. The other benefit is that it's gentle on surfaces, whether it's upholstery, wood, leather, really anything that you spray it on is fine. So we always recommend having some hypochlorous acid around for our contact lens wearers, particularly if they have to handle their contact lenses during the day and maybe they don't have access to wash their hands. This is a good thing to keep maybe in your car. If you go camping, travel, anything like that, these are really excellent to use. As far as spraying your environment, I like to recommend that our patients spray their environment with hypochlorous acid spray as well. A lot of that's because other types of agents that you clean it, whether it's like a Clorox wipe or a Lysol wipe or something like that, typically has potentially some bleach or maybe some other kind of irritating caustic chemicals. If you drop a contact lens on there, that could get on the contact lens. You put that on your eye, it could burn. It's just it's not really intended to be used around the eyes as far as a disinfectant. Hypochlorous acid spray is literally intended to be used around the eyes, so that's a little bit better there. Also, alcohol-based hand sanitizers. If anybody's a contact lens wearer and they've tried this, they probably know what I'm talking about. But if you use like an alcohol-based hand sanitizer and then you handle your contact lens, well, your eyes are probably going to burn or sting after that because, again, there's typically alcohol inside of those, and that's absorbent by certain types of contact lenses versus the hypochlorous acid spray, which is not. So we recommend Optase brand also because it's a bigger bottle. It's a little more cost effective than some of the other options on the market. I want to thank you for joining me in discussing the various contact lens solutions and salines. It is a complicated topic. There is also some complication with terminology that adds to that, I think. If you're a patient of Austin Optometry Group, then reach out with any questions. And if you are not a patient of Austin Optometry Group and you're watching this online somehow, we encourage you to speak to your doctor's office about their recommended protocol for your contact lens wear. The products that reviewed today, that's my personal preferred products. It may not be that of your doctor, and they may have a very good reason for recommending whatever that is that they want you to use. But in the end, we do encourage you to follow the manufacturer instructions. We encourage the use of on-label approved, FDA-approved contact lens cleaning agents, solutions, salines, and eye drops. As far as contact lens wear, of course, we recommend the use of contact lens compliant eye drops. Next time, we'll discuss a little bit more about how to actually clean and disinfect your contact lenses, as well as how to insert and remove your contact lenses. We can be reached on YouTube at Austin Optometry Group or Austin Optometry GRP. That's also our handle for Facebook and Instagram. As far as reaching us here at the office, our website is www.austinoptometrygrp.com.